2, 1. Good evening. We are back again this evening with our third parent university in relation to our reentry plans for Rio Rancho Public Schools. Our topic tonight is our COVID safety practices. And I just want to thank everyone again for joining us. We have found these to be super helpful for us to provide information, and we appreciate the feedback we receive from parents and teachers who are watching, and the questions that we get. For those who have not watched one of these yet, I'm going to go through the process for how you submit your questions. But first, I want to let you know we've scheduled an hour for the presentation and 30 minutes for questions. Generally, our presentations don't quite go an hour, and we reserve the remaining time for questions. And so we'll go until 7 o'clock. Here's the process for submitting your questions this evening. We have opened up the comment section on our YouTube channel, and we ask that you put your questions in the comment section. Please refrain from using this section for discussion or comments. We'll remove that so we can be sure to capture the questions as they come in. Also, please refrain from doing it, saying or putting anything inappropriate. That will also be removed. We also ask that you keep your questions to the topic being presented. We know that there's a lot of questions out there, but tonight we really want to focus on our COVID safety practices. And so questions that aren't in regards to that, we will remove those, or we won't respond to them. And then if you have a question that's not related to the topic tonight, you can still email us at RRPS reentryplans@rrps.net. We're continuing to respond to questions via that format as well. So we are going to go ahead and get started this evening. I would like to introduce you to Melanie Archibek. She is our Executive Director of Facilities, and she is going to start out this evening with her portion of the presentation. So thank you, Melanie.
Thank you. Next slide, please. So good evening. I'm really happy to have this opportunity to speak with all of you and hopefully answer your questions. Next slide. So the main thing that I want to cover first, we're hearing a lot of terms, and I want to make sure that we know what the definition is for each of those. And so the three terms that are being thrown around a lot right now are cleaning, sanitizing, and disinfecting. They are three very distinctly different processes. And so when we talk about cleaning, it's really removing dust and debris from surfaces, much like we do at home, where we're using our elbow grease to take something off of the surface. Sanitizing reduces bacteria found on a surface. So the key term here is reduces, it doesn't eliminate. Whereas disinfecting will actually kill both bacteria and viruses on the surface. Disinfectants are the only products approved by the EPA to kill viruses. And so the product that we're using here at Rio Rancho Public Schools is a hydrogen peroxide-based product. It is EPA approved and has been identified to be effective against COVID-19. On the column that you'll see, the last column in the slide, is the contact time. And what that means is that's the amount of time, so it's 5 minutes to actually kill the virus. And so the product has to be wet on a surface for 5 minutes. Next slide, please. Oh, I'm sorry, Beth, can you go back to the last one? Sorry. So there are a couple of methods that we use to apply this product. It's actually very versatile. The district has been using it pre-COVID, so we've had it on all of our sites for quite a while. You can even use it on carpet, but for the purposes of this presentation and disinfecting, there's two ways that we're applying it on the surfaces. So we're actually bottle with a microfiber cloth that's cleaned daily, as well as an atomizer fogger. And what that does, the fogger allows us to cover a larger area much quicker. The fogger will spray 10 to 15 feet. Next slide, please. The procedure that we're doing is we're working in tandem with the administrators at each of the schools. We've asked them to kind of identify the circulation patterns that the students will be utilizing, and we're utilizing that as a tool to assign our custodial staff. And so we'll have staff assigned to a certain section. They will rotate within that section all day long disinfecting. They are not to move throughout the building so that If, for instance, we did have a positive case, we have them not taking it throughout the building. They're really just staying within their designated space. Something different that we're doing because of this is we typically have multiple shifts for our custodial staff. We are bringing all of our staff in at the same time so that we have enough staff to really stay on this and rotate all day disinfecting. And so you'll kind of see the quantities that we have, what we're doing. The custodial staff will come in 30 minutes prior to school starting, and their day will last until 30 minutes after. And so they're able to kind of circulate throughout their space. They're going to focus on high touch areas. And every teacher will have available to them the spray bottle with disinfectant, microfiber cloths, as well as gloves. The microfiber cloths will be cleaned daily. And then Wednesday, of course, is not a school day. Nobody will be in the buildings with the exception of my staff, and they will use that day to thoroughly disinfect the entire building while everybody's out. Next slide, please. Some other measures that we're taking is we are installing hand sanitizers at all main entries near the playgrounds, the cafeteria, and along the circulation routes. As I mentioned on the previous slide, we are working with administration to get their traffic patterns, and we will be putting taped arrows on the ground to really reinforce for students and staff the circulation. We're installing plexiglass barriers at all reception desks or high transaction spaces. Restrooms will be disinfected a minimum of once every hour. Classroom furniture, we will be indicating areas where students are not to sit or completely removing a respective chair, and that's to help in social distancing while they're in classrooms and cafeterias. Drinking fountains, all the paddles will be disengaged, so those are the push pads to kind of minimize touching, but the bottle filler itself, every school has one, if not, actually every school has multiple bottle fillers. They will be functioning, so please, when your students return, send them with water bottles. In terms of our HVAC system, we really want to bring in more fresh air. And so we are increasing our air change rates on all our HVAC systems. And another measure that we're taking, it's a building flush out. So 3 hours prior to occupancy of the building and 3 hours after occupancy, we will have our units running continually to just completely exchange the air. Next slide, please. Oh, so I'm now going to turn over the presentation to Sel Maniaci, Executive Director of Safety and Security. Thank you.
Well, good evening, everybody. Thanks again for the opportunity to speak with you all tonight about the safety and security portion of our re-entry process. We're excited to get our children, our students back in school. So Beth, next slide, please. All right, so I want to start off by just kind of letting everybody know that parents, you are our first line of defense in mitigating the spread and the transmission of COVID-19 in our schools. We ask that you are diligent and cautious before you send your kids to the bus stop or to school, and make sure that they don't have any of the known COVID-19 symptoms that we've all heard about recently. And I'll list them for us. A temperature of 100 degrees or higher verified by a non-contact thermometer. Of course, that's what everybody knows. If they have a cough, shortness of breath, difficulty breathing, chills, if they're complaining of body aches and muscle pains, headache, sore throat, recent loss of taste or smell, and any kind of nausea, vomiting, or kind of GI issues going on. We also ask that you keep your students home if in the last 14 days, a student who's been diagnosed with COVID-19 or may live in a household with someone who's been diagnosed with COVID-19, or in the last 14 days has been in the same environment, indoor environment, as a person who's been diagnosed with COVID-19 or suspected to have the virus, or in the last 14 days has traveled outside of the state or country. So please, if your student has any of these listed items, please keep your student at home. Next slide. So buses have been a real big controversial topic. We understand that a lot of students in our district take the bus to school, and we made some great precautions on how we're going to keep that environment, that transportation environment, as safe as possible. So when we talk about general ed students, the drivers are going to observe the students' wellness as they board the bus. These drivers have been bus drivers for a long time. They know the kids, they have a rapport with them, so they're going to make those careful observations as the children board the bus. And if the student appears to be ill, in any case, we're going to reserve the front row of the bus for those students. We want to make sure that we can observe them, make sure that they're okay, and then the school will be notified to let them know that we have a student on the bus that appears to maybe have some to be ill. And then that student will see the nurse upon arrival. The nurse will take the student's temperature and determine the student needs to be placed in the care room. Now, students with disabilities, things are going to be a little different. The bus attendant on each bus will wear a face mask and a face shield. The bus attendants will take the temperature of the students as they board the bus. And if a student has a temperature of 100 degrees or more, they're going to remain at home with the care provider, and then the school will be notified. Next slide, please. So talking a little bit more about transportation measures, all drivers and students are going to be required to wear masks on the bus, and students will sanitize hands when boarding the bus. So that's going to help that whole disinfection process. Each bus will be disinfected between tiers and deep cleaned on Wednesdays. Again, we're using that Wednesday as the primary day to do these deep cleanings and deep disinfections. And windows and roof hatches will be open to maintain proper ventilation. We've done a lot of research and a lot of studying and finding that ventilation is really key to keeping that virus from settling. Next slide. So at school screening, we really spent a lot of time in this, and I'm really proud of what we've accomplished, and we've done it collaboratively with all the different departments in the district. So one of the first things we want to do is we want to have signage. We want to let people know what we expect and what some of the symptoms are and how we're going to take care of those things. So signs are going to be posted at entry points advising students of the known symptoms of COVID-19, and it's the same ones that I read to you earlier, and reporting and telling them that if they have any of these symptoms, report to the care room. We want to take care of them. We want to make sure that they're safe. In elementary schools, the staff is going to look at the students, observe them, and see if they're displaying any symptoms of COVID-19. And then all employees and students will receive daily temperature checks as they arrive at school. We have acquired these temperature taking tablets that use some of the latest technology. They're incredibly accurate, and these are the devices that we're going to use to scan students and staff before they enter our school buildings. If a student has a temperature of 100 degrees or higher, they're going to be escorted to a care room. Next slide, please. So all staff and students are required to wear face masks and shields. The desks are going to be placed at least 6 feet apart, and we're even going so far as we're shutting down water fountains, but they'll still be able to fill their water bottles so that we don't have any risk of transmission at the water fountains. The seating in the cafeteria is all faced in one direction, again, to reduce that contact, and then they're spaced 6 feet apart. And standardized signs are going to be placed throughout the building, and we're going to spend special attention to make sure that those signs are appropriate for each school setting. For the elementary school students, we're going to have a lot of visual indicators, so they know how to wash their hands and how to sanitize their hands, and then, of course, things will change as we get to the higher age groups. School administration is going to create traffic patterns, as Melanie talked a little bit about. We want to make sure that we designate traffic flow so that we keep those exposures to a minimum. And then we're going to have maps set up that'll be posted conspicuously through the buildings to make sure that students and staff alike will have a visual representation of what the patterns are, so that they can move about the school in that directed manner. And then we're going to be also designating specific entry and exit points, again, so that we keep the traffic flow reduced, and we keep it the same, so that if we have a situation where we need to go back and do any kind of contact tracing, we have those patterns clearly established. Next slide. Okay, some pictures there of how we're going to do things. Got desks and items moved out of the area. Next slide. Care rooms. I've heard some plans put together by other districts, and I've heard them call everything from isolation rooms and other things. We came up with the term care room because that's really what it is. We want to create an environment that is a classroom-like environment, that the students are going to feel comfortable in there. They're not going to feel any anxiety. We want to make it just as comfortable as we can. So, and we know that it's temporary because they're just going to be there till their parent or guardian comes and picks them up. But all the students and the staff members that are in the care room are going to be provided with the necessary PPE. Again, just like in the regular classrooms, we're going to make the desks 6 feet apart. It's going to be, that room will be staffed at all times. And again, to create that, like I said, that welcoming environment, we want to make sure that there's snacks and water available. So if they're hungry, they can get something to eat, and if they're thirsty, they have water available for them. The desk is going to be equipped with Chromebooks, so when the students are there and they're waiting for mom and dad or an uncle, whoever, to come pick them up, they're able to get work done. So not just sitting around waiting for someone to come and get them. And then if they're there for lunch, we're going to make sure they get a meal. So they're going to be very comfortable in that care room, because it's going to feel very much like a classroom. Next slide, Beth. Recess, we created this great task force, and part of that task force, we worked very closely with the principals, and it was really apparent just how important recess time is for our students, especially the elementary school students. So we have come up with a plan to reduce recess time to about 15 minutes, and we're going to wait approximately 20 minutes in between sessions. Most elementary schools in their outside areas, there's different areas that are separated by space and obstacles, and what we want to do is we think that we have at least 5 spaces in all elementary schools. So we're gonna kind of segregate the kids into these different 5 areas, and then rotate them through on a daily basis so it doesn't get monotonous. But we want them to be outside. We want them to have that opportunity to kind of refresh and get some good air. And like I said, we're going to do this, and I think the plan that we have set up with designating these different areas, I think we'll be able to do a really good job of maintaining that social distancing. And we're going to make sure that the students, they hand sanitize before and after recess, again, mitigating any chance of contact infection. And of course, as always, the masks will be required even during recess. Next slide. Rapid response teams. This is something that we're going to put together. They're going to consist of an administrative member, who will be the team leader, a nursing or medical staff member, and then a safety member. And what these teams are designed to do is to assist if we have a situation that is beyond the capabilities of a staff member who may be manning a particular station of entry, or we have a situation where we know that there was a known infection. So these teams are going to be able to respond to these locations and take the appropriate measures necessary to keep the environment just as safe as we can for our staff and our students. I could even include, like I said, escorting a student to a care room. We want to make these teams very flexible. We want to make them very fluid so that, again, whatever the situation may be, we have the capabilities to respond to it and respond to it appropriately. The next Department of Health is going to be activated anytime that we have any type of a report of a COVID-19 case, and we are going to assist them with whatever contact tracing efforts they need. We've worked very hard to develop great surveillance systems in our schools, and that was just to keep our students and staff safe. And now we'll be able to continue that mission by utilizing our abilities to help out with any contact tracing efforts. And we're going to work very closely with the Department of Health. We're going to determine what steps are needed as far as closing a classroom, the wing, or the whole school. We're always going to err on the side of caution, and we're going to do whatever we have to do to make sure that we keep everybody safe. Next slide. Well, I guess that's it. Thank you very much. I know I went through that relatively quickly, but there's a lot of information out there, and I'm going to be more than happy to answer any questions that you folks may have.
All right, thank you, Sal and Melanie. We are going to go ahead and get to our question portion of tonight's presentation, and we have a few questions that are relevant to the topic. So I'd like to introduce you to our panel. You met Sal Maniaci. He's our Executive Director of Safety and Security. You met Melanie Archibek. She's the Executive Director of Facilities. We also have Jana Chenault. She is our elementary school improvement officer. Renee Saucedo is our secondary school improvement officer. Mike Chavez is our executive director of human resources. And then we also have Joe Sanchez, who is our nurse coordinator. And so this is our panel for tonight to help answer questions. And I'm going to go ahead and start asking the questions. So our first question this evening is, why can't you disinfect nightly and not shut down the schools on Wednesdays?
We want to, hi, this is Melanie again. So we want to have them there so they can disinfect continually all day, because there are a lot of touch surfaces that will happen throughout the day. One of the main objectives between disinfecting on Wednesday is you have two groups of students when we're talking about the hybrid. So you have group A coming on Monday and Tuesday, and group B coming on Thursday and Friday. The cleaning on Wednesday allows us to completely separate those two groups. And so that's really what we want to do, is separate those two groups completely.
Thank you, Melanie. All right, our next question. If a child is in quarantine at home for exposure to COVID-19, but is not actively ill, how will he or she receive daily instruction on the hybrid model for those days they should be in class?
At the secondary level, the hybrid model automatically has some virtual components to it. And so they will do those virtual assignments, and then the teacher will also make sure, either through Google Classroom or whatever, well, it'll be through Google Classroom if they're not 100% virtual, which they wouldn't be, that they'll be able to have communication with the student and continue their education.
Yeah, and that's the same for elementary. We'll be using staff differently this year too, in ways that we haven't before. And so we have other available staff that we can have reaching out to students and supporting students who might be home, in addition to classroom teachers, but they'll still be tied to a classroom. So they'll have the opportunity to participate with the classroom, log into the Google Classroom. So even if they're not present physically, we're still going to be utilizing Google Classroom when they're present. And so they'll still be able to participate.
Thank you. All right, our next question is, why do kids have to wear masks when, according to this individual, there is no scientific data to show masks work? Joe, I might let you take that one.
Hi, I'm Joe Sanchez. I'm the nurse coordinator for the district. So the reason we wear masks is not specifically for our own protection, but for the protection of others. And so the whole point of wearing a mask is to reduce the droplets that can be generated when we talk, laugh, cough, whatever we may do. So we wear masks primarily for the protection of those around us.
Thank you, Joe. In addition, I would just add as well that we do follow the health orders as the governor and the state direct us to. That's our responsibility to ensure that we are following those health orders. So next question. How are traffic patterns going to reduce risk of exposure?
I'll go take that one, Beth. I think that by having those traffic patterns, you're not going to have that crossways traffic where you have people coming face-to-face contact. We're going to hopefully keep people in one direction as they travel throughout the school. And the second thing is, it's really going to assist the district if we ever have to do any contact tracing, because we're going to have those established traffic patterns. We're going to know which way people should have been walking through a particular hallway, and it's going to help the safety and security department access that surveillance footage so we can work with the Department of Health and assist them in the contact tracing, because that's such a crucial part of us mitigating this virus.
Thank you. Our next question. If a child is sent home for COVID symptoms, but it is the cold or the flu, is the expectation that the child will have to stay home for 14 days? And how will they keep up with schoolwork if that is the case?
So I can answer the question regarding how long they would have to stay home. We do have 3 different kind of criteria for how long people have to stay home, or whether they need to stay home at all. So if a student has symptoms, they have not been tested for COVID, they remain 3 days without a fever, and their symptoms improve, then we just need to wait for 10 days to pass since their symptoms. If they are tested positive for COVID, of course, then we would move that up to the next level. And then depending on whether or not they had a second test for COVID, they could return in as short a time as we can get 2 negative tests that are at least 24 hours apart. And then if they are tested positive but have no symptoms whatsoever and 10 days have passed from the test, then they can return as soon as they have 2 tests at least 24 hours apart that are negative. So does that make sense? I know it's kind of complicated. We will put that in our processes and procedures as well.
Thank you, Joe. And then Jana and Renee, in regards to the second portion of that question, how will students stay up on their classwork if they're out?
It kind of goes back to that question we answered a minute ago. They'll still have access. The teacher can meet with them through Google Meets, and they'll have those weekly assignments that will be assigned to all students. So they'll be able to keep up with their work.
And I would add, when students are sick, typically they get behind on their work because they're ill and they're recovering. So depending on if they're symptomatic or asymptomatic will be a guide as to whether or not they'll be able to keep up. So what we typically do with students who have that, where they're sick and they're out for a while, is there's going to have to be extra time and attention spent for those students with teachers. So that Wednesday would be a great opportunity for teachers to connect with kids that are at home that may not have gotten all the instruction they typically would have gotten, and provide additional instruction so that we can help them stay as close to possible with their peers. And it may not happen right away because if they've been out several days, but that will be a commitment that we have.
Thank you. Okay, our next question. Why are kids allowed to come into contact with one another at recess, but not in class?
Okay. We are still going to have social distancing during recess. That's why we work so hard to establish different areas for the kids to go to recess. We've shortened the recess times down to 15 minutes so that if we need to create more recess periods to be able to have the students go out and be able to get fresh air and run around and do so, but do so within the social distancing requirements. So they won't have that close, so they should not have that close contact during recess. And I believe that we've come up with some very good plans in order to maintain that.
Thank you, Sal. Our next question, how will you ensure kids adhere to safety requirements?
I'll start off with that. Somebody else may want to jump in as well, but it really starts at home. It starts at home with parents talking to their students and saying, listen, this is important. These are the requirements that the school is asking you to comply with. And that's where I think it starts. It starts at home with parents speaking to their students, letting them know how important this is, how serious this is. And then we follow it through at the school. You know, we start off, I think the student gets that first impression as they enter school, and they realize that, listen, they're taking my temperature. These are the requirements I need. If I have any of these kind of symptoms, I need to let somebody know. They have care rooms set up. They're going to see when they walk into school that there's patterns established. So I think it's a variety of environments that we're going to create that hopefully let the student know just how important it is. And like I said, hopefully they will be compliant with all the things that we're asking them to do. But the parental portion is really important.
For elementary, we spend a lot of time at the beginning of the year when kids come in, building routines and expectations and showing them how to access the different areas. That's something we're going to have to do very explicitly in elementary and make sure that students know what the expectations are and just practice. We know that it's going to be challenging at first, but what we also know is if parents are opting for the hybrid model, it's because they know, or they value, I shouldn't say they know, but they value that social piece as much as the academic piece, and they want their kids to be around peers, even if they are socially distanced. And so, you know, we anticipate that the teaching staff is going to do a great job in setting those expectations and making it as comfortable as possible for students, really building that culture in the classroom so that kids are comfortable with each other, even in this unusual situation, and spending a lot of time up front with that piece. so that it's just part of what they do, and that they know hopefully in reality, this is a temporary situation and we're going to make the best of it and do it together in the classrooms.
And really at the secondary level, as much as we think that age group of kids are different than the elementary, it really is about routine and making sure and reminding them and modeling it in the classroom. So it really is pretty much the same as elementary, just with bigger kids.
Thank you. All right, our next question. How will parking lot safety practices be handled?
So that component has been addressed in a variety of situations. Again, we know that when we go to the hybrid model, we're going to have at least half the students coming to school. That number could be reduced depending on how many parents choose the virtual learning option 100%. So security staff has always been very vigilant about maintaining proper order in the parking lots, and we'll continue to do so. Even at the high school levels where we have students parking, just like when you go to the grocery store. I went to the grocery store tonight on my way home, and I had on my mask, and I made sure that I stayed six feet apart from people that were also in the parking lot. So we're just going to take the model that we have in the school building, and we're going to apply that to the outdoor areas as well.
Thank you, Sal. Our next question, will the 6 feet of social distancing apply to student-teacher interactions?
I would say in most circumstances that will be the case. There will be situations with students who need closer contact for services that they might need to be provided, and we have guidance on that and what that looks like. All of our teachers will have masks. We have one face shield for all of our teachers. Students will have masks, so we feel comfortable that our students and staff will be protected to the extent that we can provide. For the most part, we're going to honor that 6 feet. But we know that there will be situations with students that have specific situations where teachers might be in closer contact with students.
And in those cases, we're providing all the necessary PPE to those teachers to ensure their safety and the safety of the student. All right, our next question. If a child shows symptoms of COVID-19, will they be tested? If not, why?
So I can answer that question. I think that if a child is exhibiting signs of COVID-19, the care room attendant would definitely encourage the parent to have their child tested. However, that remains a parental choice. They will not be required to have their child tested. If their child is not tested, though, they would have to have that extended time away from the schools to ensure that they did not have continuing symptoms of COVID-19. But that will be a parental choice.
Thank you, Joe.
Uh-huh.
All right, will middle school students be allowed to eat lunch outside to assist with ventilation concerns?
We have talked about that, and we are still in the planning part as far as I know on this one. But as of right now, we are looking at outside areas as well as the cafeteria for seating when students in middle school are eating.
Thank you.
So yes.
Will there be any physical barriers between the younger K-3 kids in class?
I'll take this one. No, but we are separating them within their seating. So as I mentioned, there'll be indicators, or the seats, the chairs will be completely removed so that they are placed at 6 feet apart.
Thank you. Next question, will students be able to still use lockers with the COVID safety practices?
I'll take that one, Beth. Unless Renee, if you want it, that's fine.
No, go ahead.
Yeah, I think kind of what Renee alluded to earlier, there's still a lot that we're discussing in the planning procedures. And I think lockers is certainly one of them. I don't, as we talk about patterns and traffic flows, lockers may not be accessible to every student, just depending on how we set up those traffic flows. But that's something that we'll evaluate as we go forward.
And I agree, Sal, that's what I was going to say. We're still evaluating it, but if I had to give you my gut right now, which maybe I shouldn't, but it would be that we probably wouldn't be able to use lockers.
Thank you. Our next question, will children with medical exemptions be allowed on campus without masks?
So that is a process we are still working on. I think that we will absolutely honor a physician's request to not require a student to wear masks. We do realize there are behavioral concerns related to wearing a mask and definitely medical concerns as well. So while it is our desire that every student that possibly can would wear a mask just to protect themselves and others, we will undoubtedly acknowledge a physician's request for them not to do so.
Thank you, Joe. The next question, if a student does not have a mask on, how can I ensure they do not come into contact with my child?
I think a couple of us may want to jump in on this one, but we will have, if a child shows up at school and does not have a mask, we'll make sure they have one. We have systems in place to make sure that no child will be without a mask. Now, like Joe had alluded to earlier, if there is a medical condition, I'll let someone else jump on about that. But just as from safety and security perspective, we'll make sure that there is enough PPE resources available to where if a student comes to school and forgot their mask or if it got damaged, we're going to make sure they have one.
So I guess to add on that, I mean, we're going to make sure every student has a mask that is able to wear one. And it's a school rule, just like dress code is or something else like that. They need to be wearing a mask.
And I would follow up this question for Joe. Joe, if a doctor's order says no mask, can that child still wear a face shield?
I would think that would definitely be a safe option, although I'm not really aware of face shields that are child size. So the benefit of wearing a face shield, and I don't know if any of you have tried one, but you can breathe very easily with a face shield on. They're very comfortable. You can see everything around you. There will still be students, I think, especially those with tactile concerns, that just will not be able to tolerate that device on their head. So I think we will do our best to accommodate those students, but at the same time, we will want to protect those that they will come in contact with. So it'll be a difficult issue for sure.
Thank you. Mm-hmm. All right, our next question. How will you prevent cross-infection when kids are sent to the care room?
I'll start off, and Joe, you may want to finish, but we are vigilant in making sure that the desks that the students are sitting in are 6 feet apart. They'll be provided with PPE, so nobody in that room will be in there without some type of face covering, whether it be a mask or a shield. And if by some chance we have more students than we have desks, or we need to move desks closer together, we will have clear vinyl sheets that we will separate areas with to make sure that there is no risk of cross-contamination.
Did you have anything to add, Joe?
No, I think that we'll practice the social distancing. We'll make sure they have a mask on if they don't have one when they come in. But yeah, and we'll get them out of there. I mean, our whole goal with the care room is that parents will come and pick up their children as quickly as possible. So there won't be an abundance of children in there at any one time.
Thank you. How do you ensure that every child has a clean mask daily?
Like Sal said earlier, if a student comes without a mask, we will have some masks for them. You know, we would hope that that's not a daily occurrence, and if it is, then we'll figure out what's going on, and if we need to get the student a mask, a more permanent mask, then we'll do that. But we'll make sure that kids have masks.
And can I just say that it will be part of the supply list, like a requirement that kids bring a mask of their own every day. I mean, we will have masks for kids that don't have them, but it will be part of our supply list for elementary so that it's one that they're comfortable with. It's one that they've worn before. And it's something that we're hoping that kids have practiced as much as possible and they're familiar with it and are comfortable in it when they come to school, because they fit differently. A lot of them fit differently. And so we want kids to have one that fits for them.
And then if I could just throw in my 2 cents, the beautiful thing about the hybrid model is that the student is in school 2 days out of the week. And we would hope that when they're home, that the mask is being washed and taken care of. So when they come back to school, they're back to school with a clean mask.
Thank you. Our next question, can classes be live streamed so students at home on quarantine don't miss out on live instruction?
So it's very interesting because we just brought this up and are checking into it. So I don't have an answer for you, but know that we are looking at that possibility.
Thank you. Our next question, will the school track the symptomatic students to ensure they stay out of the required amount of time, or is it up to the parents?
The school, go ahead.
Oh, I was just going to say, yes, we will. Definitely, we will be, if they show up at school and have one of the COVID symptoms and are sent home, we will absolutely keep track of those students and when they are allowed to return. We'll also work with the attendance clerks at every school to make sure that if a parent calls in a student sick for various reasons, especially if it's because they tested positive to COVID-19, that they would stay out the required number of days. So Renee, did you want to add to that? No?
No, I think that you covered it perfectly. I was going to say something like that, just not quite as eloquently.
Thank you. Okay, our next question. Will students be allowed to bring backpacks on campus and in classes with the COVID safety practices?
So we've talked about that in elementary, and I think the answer has to be yes. I know there are concerns, and we've asked for donations of Clorox wipes. We have funds at our school to buy things, but kids are going to have to transport Chromebooks back and forth if they're in the hybrid model, and textbooks and materials for the days that they're home learning, and that they're not going to be able to carry that, especially little kids. And so that will be something, and we're going to have a system and a process for where to put them so they're not collected all together and they're separated and they're just with that child.
I also think that goes back to the locker question. If you don't have lockers, you have to have somewhere where you can keep your things. So for secondary, we're still looking at that, but we understand that that's part of the question.
Thank you. Our next question, with allergy season, if a kid coughs or sneezes, will they be sent to the care room and sent home?
So that becomes an assessment issue for the nurse. I think if in the nurse's judgment, this student is suffering from an allergic response, and we know that he has seasonal allergies, no, they would not go to the care room. We're not saying that all sneezing and all coughing is related to COVID. I think there are definitely variations in the way that we might cough or manifest that symptom. So I think we would probably at that point contact parents and see if perhaps this is an allergic response that we can deal with, either with the parents perhaps providing some allergy medicine, but that would definitely be an individual consideration, not not a blanket one.
May I also add that when you register your kids, it asks if they have any ailments or conditions, and you can put seasonal allergies in there. And so if you didn't do that, I think that's a question for Terry and Paul if they're not here, but that is something that you can put on your registration that would come up when the nurse pulls up their chart, which is really helpful. So if your child does have seasonal allergies, that's something you would want to share with the school so that they're aware of that.
Absolutely.
Thank you. All right, the next question. Can my child bring her own hand sanitizer as an added precaution?
Yes.
Thank you. Next question. If a child or staffer tests positive for COVID-19, what is the process? Quarantine, shut down school, testing?
Okay, that's a complicated one. So assuming this staff person was in the schools, and I'll need some help here from the facilities people because they're the ones that know that specific criteria better than I do. My understanding is if someone in the school tests positive for COVID-19, they've been there, we will close the school down for 2 days. Is that correct, Melanie? And then we will deep clean the school before students are allowed to return. And there was another one.
It's actually, so it's a little, and like you said, Joe, it's pretty complicated. So Sal mentioned a little bit earlier that there is a rapid response team at the district. What would happen is the supervisor would contact the HR department, which then I would get in contact with Sal immediately. So he and I would be working in tandem. And then the Department of Health has established their own rapid response team at this point. And the CDC guidance right now is that either the whole building or a portion of the building would be shut down, depending on the guidance that we receive from the Department of Health. And we kind of had that discussion earlier today about the makeup of some of our different buildings. And so Joe, you're correct in that. The guidance is then exactly as you said, and Melanie, correct me if I'm wrong, but the building or the portion of the building would be closed for 2 days. That's the building portion. And then the other piece that I really want to make clear to people is that, because sometimes this is not exactly clear, then there's what Sal mentioned earlier, which is the contact tracing. And the contact, according to the CDC, would be that someone was in close contact, which means within about 3 feet of someone for 15 minutes or more. So that means that if there is someone in the building with COVID, that doesn't mean we're automatically going to quarantine everybody necessarily, even in that classroom or in the building or something like that. Sal would go back and he would begin with the help of the Department of Health to see who might have come into that close contact. And then Melanie's team would go in and deep clean the building or the portion of the building. And then the individual who tested positive, if it's an adult, needs to stay out for 14 days and would have to test negative before they would be allowed to come back to work. Melanie and Sal, what did I miss?
You got it perfect, Mike.
Yeah, I think you're spot on. And then I would just like to add that we found that a lot of these guidelines and recommendations change frequently, and we will do our best to make sure that as they change, we let parents know. But it has been a challenge just keeping up with the guidelines, just because it's such a fluid environment.
I just would like to add to that at the point that we are notified of a student or a staff member that has tested positive for COVID-19, that we would automatically contact the State Department of Epidemiology, and they would direct our steps in terms of how to manage other people in the building. So they are dynamic at guiding and directing our steps in that regard.
Thank you. Our next question, is there enough room in the schools to truly socially distance with so many staff and students there each day?
I can answer that for elementary. We mapped our classrooms and literally measured 6 feet to figure out how many desks we could get in. And we removed kids sitting at tables together, and we are able to do 15 to 18 in some of our classrooms. And so we are able to do that with parents that have chosen online. That also is reducing the number of students who are going to be coming to our campuses. When we mapped that out, kindergarten through third grade, that included all kindergarten through third graders at every campus. Now that we have a reduced number coming, we're confident that we can do that.
And it's the same as secondary. We've gone into the classrooms and looked, and we won't be moving furniture out of the classrooms, but we'll be doing exactly what you were saying. Where normally 2 kids sit at a table, there's only going to be 1, and we're going to remove the second chair. If we do have rooms with desks, we will have, the desks marked with an X that you can't sit in. So they'll only be sitting in every other desk. And kids will only be scheduled. Once the schedule is made, the counselors are going to go through and make sure that they're balanced. So we should not have more students than are allowed in a classroom. I think that answers it.
Thank you. All right, next question. Will staff be prohibited from gathering in groups like students?
Yes, the governor's order is still, there are no gatherings of more than 5 people in any space, in any building. So even staff meetings will have to still take place virtually. The only time that more than 5 people are allowed to be together would be in a classroom, where the kids are, as we've said, 50% of the normal number of students, which again, as Jen and Renee have said, it's actually going to be fewer than that probably. But staff will be prohibited from gathering or congregating.
Thank you. All right, our next question. Does a child really need 2 negative COVID tests to return to school? With testing delays of 5 to 7 days for results, that could leave my child out for 3 weeks.
That is the CDC requirement, that they have 2 negative tests, but only 24 hours apart. So we're not talking about waiting for the first test to come back and then getting the second one. You could get the second one within 24 hours. And hopefully we can speed up the rate of getting our results back, but that is, of course, something beyond our control. So.
Thank you, Joe. Our next question, will teachers need to quarantine for 14 days if they also show symptoms? If so, will they still be able to teach, or will you need a substitute for the class?
That's a really good question. So if a teacher is symptomatic, the teacher will automatically be placed on quarantine and will have to get tested. If they test negative, they can return to work. Much as the kids, they may have some other something else going on, and they'll be working with our benefits department, and we'll be working with the Department of Health. In terms of whether they can work or not, no, there would most likely be if it's the hybrid model, there would be a substitute because the instruction is actually going on in the building, not from the home.
Thank you. Our next question. How is the district or schools supporting the social, emotional well-being and safety of the children as they process and understand these restrictions and safety precautions, both virtually and in person?
We purchased a social emotional curriculum, and that's an online curriculum that can be tailored for students. And so we have that across the district to support. Our counselors will be trained in supporting teachers in using that as a tool. But we've talked about a lot about this at elementary. And so staff, and we talk about it with response to this, but we talk about it every day before COVID-19. And so our staff at each site already has a system that they use for positive behavior supports and social emotional learning. And so that will be part of what teachers implement at the very beginning of school during this virtual time. And I have examples now from teachers who have done it through games and activities, so that they're building that relationship with their students and helping them feel comfortable and not scared in that environment.
I think we recognize that anxiety is high right now. That's something that we're hearing a lot since the spring when students were sent home. There was a lot of anxiety around the pandemic and what comes along with it. So one of the other areas for August is for our parent universities, such as this session. We plan to have a session focused on anxiety and how parents can help support their students at home as well with those. We're going to partner with UNM Health Sciences Center on that. And in addition, we're looking at some other possibilities for training students on student mental health first aid. And I don't know if you have anything you'd like to add to that, Renee, but there are other things as well that we're working on. But August, definitely watch for a parent university around that as well, because it's certainly something that we should all be working together on to support our students during this time.
And Beth, can I just add, it's also the social emotional wellness of our staff as they've gone through a lot of changes, and there's a lot of pressure and uncertainty. There's a lot of uncertainty about what's happening. And so we know that that's going to be vital for our staff too. And in order for our kids to feel safe and healthy and lower that anxiety, our staff has to as well. So that's another focus for us.
Absolutely. All right, our next question. Having 15 to 18 kids in a class is above the max of 5 from the governor. Why is that allowed?
I can't speak for the governor, but I would say that we aren't allowed right now in the building. So when she approves the hybrid model, we were advised that it was about ceiling and floor space. And so if you had the 6 feet in a ceiling and floor in a room, then the capacity was what you could fit in there with the 6 feet, the 6 foot distance. And so that was the guidance we used to design those classrooms. When we switch into hybrid, we anticipate that 5 gathering will be different for school, and she'll feel like it's safe for us to do that.
Will any teachers or ancillary providers be providing in-person instruction across multiple campuses?
I believe that will be addressed in the or that'd be a good question for the special ed session. My initial thought is if they're assigned to multiple campuses as they have been in the past, that would be the case, but I can't answer that because that's a special services question.
And it is a good question, and one that we've been discussing about limiting those interactions to multiple campuses. We do recognize the concern around that. Next question. When will Fine Arts be releasing COVID safety practices for their classes?
I know that they are currently working on those practices and the guidelines. I don't know exactly when we're slated to have them out. I would think in the next week or so, but I know that they're working on them.
Thank you. A lot of moving parts, right, everyone? Okay, our next question. Since it appears that only one student at a time can have their temperature taken, won't that lead to group gatherings at temperature tablets?
So what we've done is we have purchased enough of those tablets to be distributed amongst the different schools to accommodate the population that we believe will be at the school. So there won't be just one particular point of entry, let's say at a high school per se. We've allotted 6 tablets for each high school so that we can have multiple entry points. I think we'll be able to accomplish social distancing by keeping that flow of entry moving along. The tablet takes the temperatures almost instantaneously. So I don't see a backup forming. I think we'll have staff helping out by reminding students as they come in to keep that 6 feet apart. I know that the facilities has worked incredibly hard by marking those areas to assist us again with keeping that distance. So collaboratively, we've all worked really diligently to make sure that we maintain that social distancing through each step of the education process.
Thank you. Our next question, if a student tests positive for COVID, will their siblings who also go to Rio Rancho Public Schools also need to be quarantined?
Yes. So I think that gets to the whole question, though, of contact tracing. And I'm confident that the contact tracing people would say, yes, absolutely. If you live in the same household with someone who has tested positive, you would need to stay home and self-quarantine for probably at least 10 days, assuming that you're not symptomatic. But if you become symptomatic, if you test positive, then those criteria would increase all the more. So, but yes, I think absolutely.
Thank you.
Mm-hmm.
All right, our next question, will elementary students be in contact with more than one teacher in a given school day?
That is a yes. We have related arts, we have the librarian, so it is possible if a student sees an interventionist that they might see their interventionist and the teacher the 2 days they are there. So it is possible that they will interact with more than one teacher during the day.
Thank you, Jana. Melanie, this question's for you. Will classrooms be disinfected between passing periods? And if not, why?
So passing periods, I think you're referring to secondary. Yes, we will as much as we can. We are evaluating this. We were actually at one of the high schools today, looking at an area in a designated space. There's a lot of classrooms to cover and it's a very short passing period. So I think, Sally, you said it perfectly when we're talking about a collaborative effort across the district. But our intent is to get in and out whenever the opportunity is there. So when the students are out, same thing at elementary, when they're at lunch, recess, somewhere else, we're gonna really maximize on those opportunities, but it is a collaborative effort.
Thank you. And I do believe we're providing teachers as well with some materials, disinfecting materials and cloths, like you said in your presentation, Melanie, is that correct?
That's correct. Every teacher will have it in their classroom.
Great, thank you. Will temperature rechecks be allowed if the tablet registers a fever? And are the tablets accurate?
I'll start off with the tablet. The device is incredibly accurate. Of course, nothing is 100%. And Joe, I'll let you chime in on this, but we do have a verification process where if a student does read a temperature on the tablet, when they get to the care room, their temperature will be retaken at the care room. Is that correct, Joe?
Yep, that's right. So we will automatically, if a student's temperature is over 100, they will go to the care room where they will have their temperature rechecked with a non-contact thermometer. So yeah, they'll get a second chance.
Great, thank you. So we've heard this a lot with our young kiddos, our K through 3. How are we going to ensure that they're keeping their social distance?
It's back to that training piece. We know it's not going to be perfect. We're going to do, everything we can. Kids are naturally drawn to each other. The mask helped too. At first it was 6 feet and then it was a mask. So we feel like if we have 6 feet and a mask, we have double layer protection. But if the students are wearing the masks and they end up closer than that to each other, then, just reminding them and reinforcing what that distance looks like. I've already seen teachers looking for creative ways to set up things in their classroom so that kids can visualize what that 6 feet looks like. And what we want to make sure that we reinforce a lot with students is that we're not trying to shame kids or call kids out or do anything that sounds harmful if kids do get closer to each other, those are gentle reminders. We have some very young kindergarten teachers that will make sure that other kindergartners are doing exactly what they're supposed to be doing. And they are really good at being second teachers in the classroom. But we also want to make sure that it's done in a way that kids aren't, I'm sure all of you have seen the videos going around about what's going to happen with masks and what's going to happen in the classroom. So it's going to be that reinforcing and teaching and training and modeling and visual images for kids so they can really see what it looks like.
Thank you. Will attendance requirements be waived to encourage families to keep their children at home when they have signs of illness?
Our current attendance policy excuses illnesses. Excessive absences are considered in situations where there's suspicion that it's excessive, but in a situation like this, absolutely, absences are excused.
Thank you. How will lunch be safe for my child? They can't wear their masks when they eat.
I'll address that, and maybe Melanie may want to chime in. I was at some of the schools yesterday, and I observed how the administration had set up the cafeterias, and they did a great job. The tables are set up where students sit, they're 6 feet apart, and they all face in the same direction, so there's not that face-to-face contact, and that they're mitigating that risk of molecules being able, even though we're wearing masks, eliminating that risk of that molecule transmission. So I believe the cafeterias are safe. I know that Melanie's staff I've already got a plan in place to disinfect throughout the lunch period and after and before. So I think a good plan has been established, and I feel very confident that those risks will be mitigated. And Melanie, I'll let you chime in.
You're correct. So we do have plans between each group in the cafeteria that we will be disinfecting before the next group comes in.
And Beth, can I just add I know this has been going around, but just to reinforce with parents, if you have younger children, really practicing with them now about how to open all of their items that might be challenging sometimes. We see the Go-Gurts and the applesauces and things that are harder for kids to open. If they can practice now, that's really helpful, because every time a teacher helps a child, they're going to have to go wash their hands. And so we want to try to reduce that. So if we can have our kids practicing some of those, or really thinking about what goes in their lunch if they bring their lunch, that can reduce that support, that would be really helpful.
Great point. Thank you. Okay, our next question. Are we going to require Clorox wipes on our elementary school supply lists? They are impossible to find in stores.
Not required. It's something that if you want to donate them and you have them, that would be excellent, but they're not required.
Thank you.
Yeah, I need to make sure of that. I need to check and make sure, because I know we did the same thing with, I think we took hand sanitizer off completely and Clorox as recommended, but we understand that. If anybody finds Lysol, that's jackpot right now.
Thank you. How are you addressing spread through the HVAC system?
So the key with an HVAC system is really fresh air. That's why we want to go ahead and do the exchange, increase the fresh air intake, and then do the building flush outs, pre-occupancy and post-occupancy. But key here is fresh air and circulating that air out.
Thank you, Melanie. All right. Does it have to be a mask, or can it be a face shield?
No, I think it could absolutely be a face shield. The face shields are amazing, actually, because you can see the person's whole face. You can see their mouth. We're encouraging face shields, I think, especially in special education situations, or if you have a student who's hard of hearing and they're used to reading lips, by all means, wear a face shield. They are very protective, every bit as protective from what I've read as a face mask. And if you actually wear both, you're even doubly protected. So, but no, face shields are great. But again, I haven't seen them in pediatric sizes, so I don't know if smaller children could wear a shield.
Thank you. All right, we've heard quite a bit about fevers being a major symptom of COVID. But if there is a child or a staffer who is sick that doesn't have a fever but has other symptoms, are they going to be required to stay away from school until symptoms are gone?
Yes, so absolutely, fever is not the only symptom that can be diagnostic or indicative of COVID-19. So we're doing the temperature checks as staff and students enter the building as sort of one screening measure. But by all means, if they have any of the symptoms of COVID-19, we would want them to go home and stay home. The requirements say if you have symptoms, but you're not tested, you have to go 3 days with no fever. Your symptoms have to improve, and then 10 days have to have passed since your symptoms first appeared. So if you don't want to get tested, you will have to stay home for at least 10 days since the symptoms first appeared. The other option, of course, is to go get tested, but then you do need 2 tests, and they have to be at least 24 hours apart. So there's some pretty stringent requirements from the CDC there.
And that's for students that Joe is talking about. If it's a staff member and they're symptomatic, as I said before, they would contact the Human Resources Department, the Benefits Department. They would be asked to go get tested. We would wait for their test results. They would be on quarantine until we got their test results, and then we would be working with the Department of Health, and we would move forward from there with their test results. But you're absolutely correct, Beth. It's not just the fever; it's any of those symptoms. And I know that Sal has worked diligently to make some really great signage for the schools to remind people of the multiple symptoms that you can be experiencing with COVID-19.
Thank you. The ADA allows for very few legitimate medical exemptions in regards to wearing a mask. Will nurses honor every doctor's note they are given, or will there be parameters and rules?
That is a difficult question. You know, I don't think that this nurse's role is to supersede a doctor's orders. So if a doctor ordered a student not to be required to wear a mask, I do think we would have to follow those guidelines. It is a topic that we will need to discuss, of course, throughout the district, but you know, doctor's orders are doctor's orders, and I don't think nurses will supersede those orders. I think that would have to be a district level decision.
Great. And then our last question, this will be our last question for the evening, and it's a difficult question, but do we have concerns for an asymptomatic carrier possibility in our schools?
So I think everything we've heard about children is that they're asymptomatic carriers, right? They don't get the symptoms that the adults do. They're sick and we don't know it. So absolutely, that's a concern. And that's why we're asking them to wear masks, quite honestly, because they might have the illness and we would not know about it, and they wouldn't know about it. I really don't think that most parents are planning to send their sick children to school deliberately. But children are just not as prone to exhibit symptoms related to COVID-19. So it is a concern. And that's why we are asking everybody to wear a mask.
And Beth, can I just add that during the summer, the daycares were functioning in New Mexico, and they were very successful, and people were very healthy. So the procedures they put in place, all the precautions they put in place that we're trying to put in place, or we will put in place, were very effective in the daycare facilities. And so if anybody's interested, that information's on the New Mexico Public Education Department website. If you're curious about what the results of that were and what happened and what transmission was look like and what they did, they have information on their website that they shared with us. I think that helps us in what we're thinking and planning and gives us some data around what it looks like in a facility.
Thank you.
And I just wanted to add, I'm sorry, Beth, I just want to add for our staff and our adults too, that adults can absolutely be asymptomatic and have absolutely be carrying the COVID-19 virus. And, the science is absolutely positively sure and certain around the effectiveness of masks in not preventing, but slowing the spread of this disease. And there are multiple videos out there, including one that the governor mentioned this afternoon on PBS, which show the effectiveness of the mask. So I just want to, reiterate what we've said all along between the social distancing and the masks, that how important these are, because it's not just the kids. Joe's right. The kids are very asymptomatic. You can certainly have an adult in that building, your colleague, and you may think, oh, it's okay for my colleague and I to sit down and have lunch together. Please social distance, wear your masks.
Great. Thank you. And I would just add, these are very difficult times for our families. We've heard from our parents. We're hearing, what a difficult decision it is to try and decide between going hybrid and sending your student back to school or keeping your student at home. If you really do not feel safe having your student at home, those are why we have created those options for students to do the 100% virtual. In addition, if you don't want your student wearing a mask and there's not a medical reason, that's another option. You can utilize that 100% virtual model. We're doing our best to ensure that our parents have options, as we do recognize that these are tough decisions to make. It's hard to know. There's so much information out there one way or another, and it's really hard to know what is right and what's safe. And so everything we're doing is to try and ensure the safety of our students and our staff, and to reasonably create situations where our students feel safe in the buildings. And so I'll give everyone one more opportunity if there's anything you'd like to add, and then we'll sign off.
Hey, Beth, I just want to kind of a little message to the parents and students who are listening, that I'm so proud of the people I work with, that the hours spent developing plans, a change happens, we develop new plans, something else changes, and we develop another new plan. That the hours that the people you see on the screen, and then the people that are not here tonight, that we've spent to protect our students and our staff, has just been amazing. And like I said, it's just I'm very fortunate to work with such professional and dedicated people. And I hope you guys feel the same way, because it's a great district, and I think we've done a really great job of preparing for this. And we're always going to be fluid. We're going to be dynamic, and we're going to make sure that we have plans in place to change as the virus changes.
Thank you, Sal. Anything else? All right. I'll remind everyone, if you had a question that you didn't get answered tonight, please feel free to email us at RRPS reentryplans@rrps.net. In addition, this will be available on our website, tonight's session for Parent University. And so if you need to go back and watch it again, if there's more information that you'd like to see again, you'll be able to rewatch it, or you can share it with family or friends that you feel it would be important for them to watch. Thank you for joining us this evening. I'd remind you, we have 2 parent universities next week. Next Tuesday evening at 5:30, we're going to talk about what transportation and food service are going to look like. And then next Thursday evening at 5:30, we're going to talk about what we have in place for our students with disabilities and the plans around that. I know there's a lot of questions out there, and so we want to make sure that we address those questions. So I just want to thank everyone again and hope everyone has a safe and enjoyable evening. Thank you.